Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today we are going to discuss one disease or the illness which is known as hand, foot, mouth disease. This is one of the illness which is common in the children. As you have read the video description, this is a disease which affects the hands, foot and the mouth area. Now what happens to that area, whether this is preventable, whether there is any vaccine available for this, what are the signs and symptoms of this disease, how severe or how mild is this disease, in what age group the children are getting affected with this disease, can adult also get affected with this disease. All these things we will discuss today in detail in this video. So watch this video till end. Thank you. Friends, hand, foot, mouth disease, as the name suggests, this is the disease which is affecting the hands, foot and the mouth. There are small red colored rash appears over the hands area, foot area, in the mouth area. Many times this rash are of the soft red color spots over the palm of the hand, sole of the hand, around the mouth and inside the mouth also. And some of the areas like the buttocks are also getting involved. So what will you see? You will see the red color spots over the palm. It may extend up to the elbow. Over the sole, it can extend up to the thigh. Over the buttocks area or the bums area. Around the lip, surrounding the lip, over the tongue and inside the palate, you can see the small red color spots. Many times it can take the shape of the boils. You can see the small boils over these areas, and many times it can be water filled also. So this is one type of the virus which is affecting into the children, mainly younger age group, around 7 years age group. It can happen around 1 year to 7 year of age group. Older children are unlikely to get affected. Adults are generally not getting affected because they are already immunized or they have the sufficient immunity to fight with this virus. So this is one of the viral illness, common virus known as enterovirus in our terminology. They are causing this kind of the illness. How the disease starts? This disease starts with the high grade fever. Most of the time the children runs very high temperature like the 39 degree temperature, 40 degree temperature, and it is a continuous fever. Every 6-7 hours you have to give some medication to reduce the temperature. But even if you will give the plain paracetamol, brufen, fever keeps on recurring, and generally on the third or the fourth day these spots will come. So the illness begins with the fever goes and the rash comes, and the rash is of the typical distribution over the hands area, foot area and the mouth area. That's why this is known as hand, foot, mouth disease. This disease is quite infectious. It spreads very rapidly into the nursery, school, dormitories where the children has lot of engagement. Generally it spreads through the contact. Sometime with the respiratory secretions also it will spread. So basically the body fluid which comes in the contact, then it transmits the infection. So in the nursery generally the children share their food, share their utensils, share their stationaries, so it will transmit from one child to the another child. How severe is this disease? On an average this disease is not that much severe. Generally over 6th or 7th day child will start getting better. The fever generally subsides on the 3rd day and the rash generally subsides in a 1 week time. What is the main problem with this type of the illness is that as the children has the spots inside the mouth, they might have small ulcers also inside the mouth. So very small children don't able to eat well or don't able to drink well because they will feel pain while they swallow the material. Even to swallow the saliva is difficult for these children. So that's why the only issue with this type of the illness is related to the hydration, because the child might get dehydrated. So what parents has to look after? Number one is to control the fever. So you can use paracetamol or the ibuprofen to control the fever. Second thing, hydrate the child well. Give more water, liquid, soup, juice, maybe warm fluid which child can swallow easily, so that they will feel hydrated, they will not get dehydrated. Many times this rash has little bit itchy, so that's why children scratch the rash. So we have to give like symptomatically any antihistaminic medication to reduce the itchiness for the child. And sometimes it requires some local applications like the calamine lotion over the rash area, so that child doesn't have much irritability and child don't scratch it. So let's summarize the disease as a whole, that this is a viral disease. It affects the smaller children, generally less than 6 to 7 years of the age. It starts with the fever, high grade fever, stays for 3-4 days. Once fever goes, rash will start appearing. The rash will stay for around 5 to 7 days. Highly infective, transmits into the nurseries, schools, and in the seasons like the summer, you will have the outbreak. There are so many cases of the hand, foot, mouth disease. Per se, there is no any vaccine for this, and this is also like the very benign, mild illness. So as a whole, there is no need to get scared with the name, no need to get panic if the child gets the hand, foot, mouth disease. Only some variety of the hand, foot, mouth disease which may get complicated in the children. Sometimes it can cause severe headache, persistent vomiting. Those are the signs that the virus has penetrated the brain and it is causing the meningitis. So in the hand, foot, mouth disease, when there is a high grade fever, persistent vomiting, severe headache, extreme irritability, take to the hospital immediately, so that even if he is getting any complication like the meningitis, can be diagnosed early and the treatment can be started. Per se, the illness doesn't require many medication, but the most important medication you can say is the hydration. Hydrate your child well, give more water, liquid, let him take rest. In a time frame of 7 to 10 days, child will improve without any side effects, without any complications, and any complications are there, you can get to the hospital immediately. So this is the brief about the hand, foot, mouth disease. It is very common in the summer months, and generally when there is a switch over of the seasons like the autumn, at that time this spreads very widely. So I hope that I have tried to clear out most of the queries related to hand, foot, mouth disease. I have tried to give information about the hand, foot, mouth disease, and if your child gets it, then you should not get panic, because this is a very mild, benign illness, and over a 7 to 10 days it cures by its own, or maybe just simple medications might require. So I hope this information is useful to you, and you will help me by spreading this information to other family friends and the parents, so that they can get acknowledged with it. If you are first time on my YouTube channel, you can subscribe as well, so that you can get notifications by pressing the bell icons. Thank you very much.